Good afternoon and welcome, everyone. Thank you for joining us for today's webinar. My name is Catherine or Kat Thiel, and I'm a co-investigator in Partners for Advancing Health Equity, or P4HE, a national research learning collaborative based at Tulane School of Public Health and Tropical Medicine and funded by a grant from the Robert Wood Johnson Foundation. Today's webinar is co-sponsored by P4HE and our School of Public Health's Office of Alumni Relations. We want to start by acknowledging that the land we're standing on in New Orleans is known as Bilbancha, a Choctaw word meaning place of other languages, and we honor generations past and present of the several tribes who live in this region. At P4HE, our aim is to bring scholars, funders, community members, and private sector representatives to work together to better understand critical issues relating to attaining health equity. We do this in part by providing spaces for activities to engage with these groups in insightful conversations on timely topics and to promote actionable solutions. We want to move beyond simply documenting health inequities to identifying the actions required to actually achieve equity. During today's webinar, we continue our focus on a specific but very important issue, violence, and gun violence in particular. Violence is a major public health concern and a key driver of health inequities. It's quite possibly our greatest and most longstanding pandemic and must be treated like the public health emergency it is. Prevention requires transdisciplinary, multi-sector solutions. Gun violence traverses all types of communities and is now the leading cause of death among children ages 1 to 18. Gun injuries and deaths aren't just the result of mass shootings and community violence, of course. They can be related to intimate partner violence, child abuse, suicide, accidental discharge, and more. Today, we'll engage in a conversation with experts in violence prevention and practice, all from our very own Violence Prevention Institute and its CDC-supported Center for Youth Equity, or C4HE. CYE. CYE is one of only 5 centers across the U.S. devoted to youth violence prevention. We're really excited to have you here today. So let's get to the topic at hand. Over the past few years, gun violence or firearm violence has risen to the forefront of the public's consciousness. The root causes of gun violence in the U.S. are complex, deep, and far-reaching. They are embedded in our social structures, our systems, our institutions, all of which prohibit people from meeting their basic needs. As such, gun violence is a consequence of ongoing and historical structural violence, which is also evident in the racial inequities we see in gun violence in the US. For example, Black Americans are 10 times more likely than white Americans to die from gun homicide, and Black children fare even worse, with Black youth and teens 14 times more likely to die from gun homicide than their white counterparts. The complexity of community violence is depicted in the figure shown here from Dr. Mari Nation as part of the White House Bureau of Justice Assistance Community Violence Intervention webinar series. Key factors in the production of violence are structural determinants, which you see at the top, and structural marginalization, but the structural determinants are key strategies or tools used to maintain social determinants, which include laws, policies, practice, values. These social determinants are products of historical determinants, such as white supremacist ideologies and narratives, which have contributed to the current experience. This structural violence then leads to both direct and indirect effects. Direct effects include collective as well as individual trauma, while indirect effects include factors such as economic opportunity or inequities, social inequities like social support or supervision, physical and psychological inequities, all of which influence individual and interpersonal violence, where a lot of our effort has focused. Structural violence, though, refers to the multiple ways in which these social, economic, and political systems expose particular populations to risk and vulnerabilities, which can lead to increased morbidity and mortality. These systems include income inequality, racism, homophobia, anti-Semitism, sexism, ableism, and other means of social exclusion that lead to these vulnerabilities. Things such as poverty, stress, trauma, crime, incarceration, lack of access to care, healthy food, physical activity, we can go on and on. Structural violence are also forces that harm certain groups of people, producing and perpetuating inequities in health and well-being. And addressing all forms of violence requires an understanding of the ways in which these root causes connect and overlap on multiple levels. Our collaborative is committed to bringing people together and organizations across sectors to work toward our shared goal for equity and health equity. It's clear that we have a long way to go in addressing the pervasive culture of violence in the US and beyond, So today we've invited 4 panelists across multiple sectors who are doing that work to give their perspective on the next steps toward achieving equity through violence prevention. So welcome everyone to the conversation. I'd like to start by asking each of our panelists to introduce themselves and their work in gun violence prevention and how it relates to both structural violence and health equity. Ms. T, let's start with you.
Good afternoon, everyone. It's a pleasure to be here with you. My name is Tamara Jackson Snowden. I'm a licensed clinical social worker. I'm the executive director of Silence is Violence. I'm the clinical supervisor with the Mayor's Office of Gun Violence Prevention in New Orleans. I have 17 years of experience of responding to violent crimes here in the city, particularly homicide scenes in Orleans Parish. I do direct responses, offering support not only to victims and their families, but also law enforcement. So today we'll be sharing with you our own perspectives. So I look forward to the conversation and I'm glad you all are here.
Oops, I'm on mute. Sharvin, how about you?
Thanks, Kat. Thanks for having me this afternoon. My name is Sharvin Tagavi. I'm a trauma surgeon at Tulane and University Medical Center. Kind of a big majority of what I do is treat patients who are victims of gun violence. I'm also a public health researcher, and I've always believed that the best treatment is prevention. So my research is involved in, involves kind of identifying structural factors that lead to gun violence. And then also I'm interested in hospital-based approaches to preventing future gun violence, because I believe that when someone is hospitalized with a firearm injury, that represents a teachable moment where we can hopefully try to intervene and change the course of somebody's future.
Sharvin. Tio, how about you? Want to introduce yourself?
Yes, my name is T.O. Hardiman, president of Violence Interrupters not-for-profit organization. And we are, what you might say, we have a public health model when it comes down to reducing gun violence. I've been on the front line. I created the Violence Interrupters back in 2004. It's been seen more like being implemented throughout the nation and internationally as well, but I also teach in the field of restorative justice and criminal justice as an adjunct professor here in Chicago at North Park University. But I look forward to.
Thanks, Tio. And also a presidential candidate at one time, right, Tio? Or...
Yeah, one time, and a gubernatorial candidate too at one time. But I'm out of politics now. No more politics.
Oh man, we need you. All right,
That's right.
Julia, your turn.
Yeah.
Hi, everyone. I'm Dr. Julia Fleckman. I'm an assistant professor at the Tulane University School of Public Health in the Department of Social, Behavioral, and Population Sciences. I'm also one of the associate director for the Violence Prevention Institute and our senior director for our Gun Violence Policy Lab, as well as run a brand new hospital-based, or I should say hospital-initiated program here in New Orleans to support survivors of gun violence, along with the lovely Miss Tamara Jackson Snowden as well, and Dr. Sharvin Tagavi. So it's nice to be here with you all.
Thanks, Julia, and thanks, everyone. All right, so we'll start with some questions and discussion. Feel free to pop in. Much of the debate around gun violence, as you all know, has really focused on gun regulation more broadly and keeping deadly weapons out of the hands of potential killers. But guns are only one tool, and the use of guns traverses many forms of violence. How can we in our interdisciplinary fields and practices improve our prevention efforts by connecting all forms of violence? How might the field benefit from cross-sector collaboration to advance violence and violence exposure prevention? Theo, let's start with you and kind of thinking about this.
Collaboration is key. You have so many different areas that we need to concentrate in, like the lack of mental health services, trauma support services, violence interruption right on the ground level, and then also dealing with structural violence. So there's a lot of education that needs to be done when it comes down to working with high-risk individuals and educating elected officials and policymakers, along with some of the foundation people in throughout the United States. It's it's like a safety net. We need all hands on deck all the time, because the street work is just where the tip of the iceberg. we have to deal with all the other issues associated with deprivation, lack of resources, communities that are de-stressed communities, you name it, the whole gamut of issues out there that we must address. Because a lot of times when we work, for example, violence interrupters in Chicago to date, we've mediated around 32 conflicts that were high-level conflicts that could have turned deadly. We stopped it on the front end, but after we mediate the conflicts, that's when all the support services kick in. We have to make sure these young people get to receive the services that they need in order to help them become productive members of society. But we cannot do that alone. That's why it's important to network and educate as you go, because people are dealing with the here and now, when they're out on the streets. They know what I need right at this moment. So how can you help that person think on a higher level and make, educate them to the point that it takes time in your life to become productive. But if you learn violence all your life, that's what you're used to. That's why we try to help them unlearn violent tendencies and violent behaviors. That's what we are on behalf of violence interrupters. But connecting, collaborating is so important. Very, very important.
Yeah, thank you. I know, and Tamara, you've worked on a similar model here in New Orleans, but I guess your thoughts on, and I know it's tough and takes a lot of resources too, but really thinking about this cross-sector collaboration, but also broadening the scope of forms of violence in your work.
Yes, in my work, I do a lot of violence work with the understanding from the clinical context of trauma. And a lot of the individuals that we're working with have experienced generational trauma. And one of the concerns for me is that oftentimes we don't look at root causes for why individuals choose violence as a space that they occupy to resolve conflict. And then looking at that from a clinical lens, we look at the generational trauma that individual have experienced. We look at the adult that may have had adverse childhood experiences that was not addressed, and then they become the adult who's trying to struggle and who's struggling, I should say, with their emotions and the best ways to navigate that. And that's difficult when we're saying, hey, gun violence is on the rise. But for an individual that has had a lifelong journey with violence and negativity, not having the support of parents, not having the support of an educational system, living in poverty, dealing with structural violence, understanding the complexity of racism and how that impacts how we move, how we thrive in our community, then it's a different conversation we should be having. The love and support is definitely a space where we lack as individuals with giving that before the violence happened, making sure individuals have resources before the violence happened. So understanding for me the importance of healing in this journey is the best way that we can work towards reducing gun violence in our community. Individuals are broken. And we look at a lot of conversations now is around youth violence and young people and the decisions that they make. But we're not taking into consideration the challenges that those children face. And the best ways to support that is, again, nurturing, using a strengths-based perspective and how we support that generation.
Yeah, definitely. Thank you.
Yeah, I just want to highlight that I think the common thread that we're hearing across all of these folks is that there's a real need to address the root causes, right? And to do so in a way that goes beyond any one discipline or field. There are historic disinvestment of communities and neighborhoods, a growing income inequality gap, and a real need to really think about how we address those as root causes and how we support families from the get-go and how we support young people as well, and thinking, about the support and services that they might need too. And I think that kind of highlights where we can kind of all meet in the middle about this as an issue, and about, I will say, most types of violence and public health issues as well, right? I think this type of structural violence, these types of structural inequities are really what lead to a whole host of issues. And we need to get on board with really thinking about those drivers, right, to improve health and well-being overall, including gun violence.
And I'll say, my experience as a trauma surgeon, we see patients who are victims of firearm violence, and I'm trained. I have the tools to kind of help them steer the path of what physical needs they may have to recover from their injury. But I don't have the skills that Ms. T has. I don't have the skills that Dr. Fluckman has to kind of write the path and give them the resources for the emotional recovery. So there's not one person who has the expertise to deal with this very complex and multifaceted problem. So collaboration is truly needed.
Definitely echo it all. And from a research perspective too, really understanding all of these multiple forces. And, in public health, we've pathologized a lot, focusing on outcomes, but violence is such a cross-cutting outcome. There's no National Institute for violence prevention. And, it's hard to kind of fit some of our work into, a neat frame, given the complexities. So I agree from a research angle, it's also important for that cross-sector and discipline perspective. Great. So there's also been limited attention, I feel, dedicated to the impact of gun violence on victims and families and impacted communities. Individuals killed and injured in atrocities such as the recent mass shootings or police killings are publicly remembered and mourned, but the victims of these tragedies are not limited to those killed, injured, or present, right? And so, we're seeing a growing research in this, but the consequences we know of gun violence, as you all have talked about, are more pervasive and entire communities are affected. And so how do we really broaden the focus of the gun debate to include the social, emotional, physical, and mental health impacts of those traumatized, especially children and youth? Julia, I know this is an area you and I both work on. So let's start with you. And also, what are some of those long-term and health and social impacts of such exposure?
Absolutely. Thanks, Kat. I think that's a really important question to think about. We oftentimes in public health really look at physical health when we really need to be looking at emotional well-being, mental well-being, behavioral well-being as well. And I'll just say that, beyond just individuals that are directly impacted by gun violence, what they experience physically, there's a lot of, and the physical trauma there's a lot of emotional and potential mental health trauma that goes along with that, right? And I think that's overlooked. We oftentimes, see a lot of debate in the news media right now, and with certain folks saying, mental health is a driver of gun violence, and I would argue that it is the exact opposite. In fact, if we really looked at folks that have a mental health issue that have committed acts of violence, it is they're very, very few and far between. In fact, if we address that directly, it would reduce gun violence by less than 6%. But there is a huge mental health impact for folks that have experienced that type of physical and emotional trauma, right? So really figuring out how we support people that have experienced that, not only directly, but the people around them, right? And I'm thinking about, folks that might have not only witnessed an incident, right, where they might have seen something that is incredibly violent or traumatic, but maybe have heard about it or are seeing the direct impacts on a loved one, right? There's quite a bit of research that I think is really important for us to look at around caregiver trauma and around caregivers that experience vicarious trauma just from, witnessing and taking care of someone that might have a physical, mental, or behavioral issue, right? And how difficult that can be on a caregiver. I think we can also see that when it comes to something like this, right? For not only caregivers and people that are directly responsible for, the well-being of that person that might have experienced a gun injury, but, for children, right, that might be directly related to it and are seeing their parents go through this incredibly horrific event and might not quite understand, some of the behaviors or actions as a result of that, and might internalize and process that differently, which I think, we've seen also just the growing impact collectively and the collective trauma it can have on communities that are disproportionately impacted by gun violence as well. So I think it's really, really important that we think about prevention, but we also think about how we better support folks, and I think, disrupt that cycle as well, both addressing those root causes and providing direct support and services for folks that have not only experienced an injury, but those around them, their loved ones as well. And that's part of what we're trying to do with this new research program, and really thinking a little bit more holistically about those that have been impacted to hopefully disrupt that cycle.
And also dealing with the trauma that people have to experience. Trauma can be a lifelong experience. I'm working with a young lady right now. She's blind. Her 15-year-old son was killed. And he was like, she would work with him as another set of eyes for her. And now she's dealing with the loss of her son, and she cannot go to the store like she used to because she doesn't have anybody, no more, she doesn't have a lot of family support. So I've assigned a couple of violence interrupters to take her back and forth to her doctor's appointments, to the store. But this is the thing with trauma. That's the reason why restorative justice is very important, because the victims are sometimes overlooked. When you hear about these stories about people being shot in Chicago, New Orleans, Memphis, Detroit, New York, or whatever, nobody talks about, they mention the victims, for a moment, but the aftercare has to kick in to support family members that have lost their loved ones, because people are hurting out here. I know a young lady that she ended up passing away of a broken heart because her daughter was killed. Her daughter was an inspiring model, and we worked with her for a while, but she just couldn't get it back together. And she ended up just passing away from a broken heart. So we have a lot of work to do in the aftercare department dealing with trauma. And I think it would be good to bring, so what we do on behalf of violence interrupters in Chicago now, we organize restorative justice peace circles with victims of gun violence, people that have lost their family members, and victims who've been shot themselves sometimes, and they survive. So we bring everybody together on a monthly basis to talk about how they're feeling, what they're going through. So that's just a part of the higher level calling of the work of, all of us work together, but trauma support is so important. Then I'll say this, a lot of times when it comes down to even in the research or the funding arena, there should be some funding that goes, we need to raise funds for victims of gun violence, really, so they can receive the help and care they need ongoing, because a lot of people are raising funds to work in the field of violence prevention, but let's get some direct money and funds to the victims that lost their loved ones, because all of us use the numbers of the victims to write proposals anyway, right? So many people got killed this year and last year compared to this year. Let's raise money for the victims out there. That's what I'm talking, funds rather, for the victims, for different programs to help them. And somebody said something about mass shootings. I did some work here in Chicago and Highland Park. There was a mass shooting about a month ago. So the mass shootings, the trauma that comes after the mass shootings, like I say, it could be lifelong because people are hurting out here. But when it comes to mass shootings also, I don't want to get too technical with it. I see where law enforcement, to some degree, they've kind of missed the mark a little bit with being able to really prevent some of the mass shootings, because some of the profiles of mass shooters, they are telltale signs. Some of these individuals have, they've been in touch with law enforcement before. They're purchasing multiple assault weapons, and then they've left put it like this, a footprint on social media. But their social media is not being checked. So when they commit a mass shooting, it's like the red flags were there, but nobody paid attention because they're saying, well, that's just the way this person might be. He'll be okay. But that's not the case. So, but now cleaning up the mess afterwards is just like what happened in, what's that, Texas over there? What's the name of the city in Texas where his children were shot and killed? The one guy, he passed away after his wife was killed. He died the next day of a heartbreak. So understand what's going on. And when kids are killed, it's like ongoing work. I'm talking about forever and ever and ever. And I don't have time to get into my own personal life story. I grew up in the heart of the ghetto, projects on the west side of Chicago, experienced gun violence on a regular basis in my community. And I became desensitized towards the suffering of other people for a while. I had to bring myself back around. So now I'm really concerned and I really care about people, but more work has to be done on the front end. We have to get out there and detect and prevent on the front end. And I would like to applaud everybody working in the field of violence prevention, especially at the hospitals, because right there, we also have like what you call a hospital program, and we call it the golden hour, the first hour when somebody has been shot, when all their family members are up there talking about retaliating. That's that golden hour. The doctor can maybe get through to the individual, or some of the violence interrupters just the same, and outreach staff. So that's my comment there.
I'm
Yeah.
sorry to pop back in, but just say I think Tio's right on, and a little bit what we're talking about. There are some models out there that
Yes.
are really well designed and not only researched, but have been implemented in a variety of settings where they've demonstrated really promising, I think, and important results. Obviously, that needs to be adapted to local context wherever you are. But this is a national, I'd actually say it's a major international issue. And there are big lessons to be learned about what people are doing, and as one example, there's a trauma recovery center model that has, been sweeping across the country nationally in the US that has wraparound services that are free and accessible for both victims of trauma, and they're looking at a bit more broadly than just gun violence, because there's all sorts of trauma and violence that exist, which I think is also important to connect. They're looking to bring, including a bunch of local partners, and hopefully through the trauma recovery clinic that exists at our level 1 trauma center, University Medical Center. Some folks over there are looking to really expand that model to have a full center here in New Orleans. And I know many other places are doing similar work.
Yeah, definitely. And thanks everybody for all the great comments in the chat. We have a lot of questions. We'll probably get to a lot of the questions in the end. So Curtis, I see your hand too. If you want to pop them in the chat, we'll include them. I see one that is related, so I will bring this up. And someone's asking about whether we use ACE scores or adverse childhood experiences to target populations at potential increased risk of violence. And, I think a lot of us use it in research, of course. In practice, it also becomes more difficult given the resources available. And, if we're screening a large population and uncovering more than we can or have the capacity to deal with, it just becomes an issue. So I don't know, in your practice, Tio or Ms. T at Sharvin at the hospital, are you guys using ACE scores for any type of screening at all?
Well,
Yeah.
I learned how to share the podium, so I'll let somebody else take that question.
Um,
That's right.
ACE scores when working with victims and families, particularly children who have lost their parents or guardians to violence. I'm using ACE scoring just to see what the adverse experiences have been over time. And even talking to families, we find that there has been, as I stated before, generational trauma that's been untreated, right? Folks are having a vast number of experiences that are trauma related, whether it's growing up in a domestic violence household, if it's the parent that's been incarcerated and not there, if it's the constant being expelled and put out of school. We know there's the school or prison pipeline. All of those experiences are traumatic. But one of the things that we have to be clear in doing this work, there's still that racial divide, right? When we look at our Black and Brown communities and compare them to our white communities and some of the things that exist, resources are limited. They don't have access to care. And even with the criminal justice system, the justice system in those cases, the punishment is not the same, right? So our communities suffer as it relates to structural violence, and then there's no hope, and people are trying to figure out a way out. So in that, during the screening tools, it helps us get a better idea of what are the best places that we can offer support and healing and resources for that population. The sad, unfortunate space is we don't have a lot of resources. It's only a few of us out doing the work with this population. One of the reasons that Silence is Violence started, because gun violence victims, homicide specific, they didn't have a space to go. They didn't have any recourses or agencies offering support to that population here in New Orleans. We have a ton of organizations doing sexual assault and domestic violence work, but nobody was really working with victims of homicide and understanding the complexities of trauma. And we need to look at it in a trauma-informed lens. When you're working with these families and the community, not just the family, but communities are impacted too. When I'm responding to homicides in Orleans Parish, it's not just the victim and the family of that victim, it's that community. Because a lot of times those victims don't live in that neighborhood. So that community is traumatized. They may have kids who witness that murder in their community. So we need to have some serious and pointed conversations about how we actually deal with gun violence. Looking at it again, I can't drive it no more than what I like a trauma-informed lens. We have to use a more holistic approach as we continue to do research, continue to provide supportive services, and continue to have these conversations.
Yeah, that's somebody had asked a question about how do you help people change their mindsets. Do you want us to take any questions now? You want to wait until?
Yeah, we can. That was actually one of our questions, so we will totally get to that. And yeah, I can definitely move on. We have a few more, and just to link it back to health, a lot of trauma and violence has been shown to impact people biologically, which again later could lead to health impacts. So large effects across the board, but yeah, lots of work to be done. Thank you guys. I'll skip to that question. Thanks, Tio, for pointing that out. But yeah, dealing with the determinants of violence, especially in the US, where sometimes politics seem to outweigh the common sense and love for our fellow humans, and where violence seems to be a norm. And our violence industrial complex and those that benefit financially from it is so massive. Tackling violence seems overwhelming at times. And so one of the questions to the panelists, again, probably brought up by many of you, is how do we change the narrative around violence and change norms in our society? I'll open it up. Anyone, Tio?
Well, I'll say this quickly. There's a need for multiple messengers. The violence interrupters, we meet the people where they are. And once we, pretty much establish an understanding with them, then we turn them over to other, key stakeholders in the community. That's where the doctors play a role, the practitioners play a role, the social workers play a role, law enforcement even plays a role, because it's very important to understand the mindset of individuals and put yourself in their shoes momentarily, because a question was asked here, like, how can you tell a person not to have a gun to protect themselves when they're living in a concrete jungle? That's a fair question, because what happens, most of the guys that I work with, they would rather get caught with a gun than get caught without it, because if 4 or 5 guys run up on them, they could perhaps defend themselves. So what happens after all that's taken place? So if we can just begin to build safer communities where people can have a safety network, where they can go maybe talk to a mediator that has credibility and has a strong relationship with the would-be perpetrators of gun violence, then we can get somewhere out here. That's why it's important to have people that have been trained in the field of violence interruption services, people that have fortitude and strong, strong relationships with people that think violently. Because, you have psychopaths out there and you have sociopaths. We have to be honest, let's not be in denial. When you're dealing with a psychopathic person, that's not easy to deal with them type of individuals, but they do listen to somebody. Like I have a relationship, God has blessed me, blessed out of peacemakers. My birthday is on September 21st. I won't tell you all the year, but the thing is, I was born on the International Day of Peace. Blessed out of peacemakers. God has given me what you call a special anointing, where I can talk to these psychopathic type of minded individuals and make sense of the madness, and then help them turn themselves around. And we have a proven track record there, where we've helped turn around at least 300 people's lives over the last 10 years. And now they're productive members of society. They've obtained their master's degrees in some cases, and they're doing quite well for themselves. But it takes a whole lot of lead work and constructive shadowing with individuals out here. And then lastly, young guys that are out there on the streets, running the streets every day, how do you keep their attention? That's not easy, because you're not out there with them 24 hours a day. So it's all about having a strong relationship with them and identifying somebody in their family that can assist you at times as well. That's equally important when it comes down to the work that we do on a daily basis. But changing mindsets, it just takes time. And what we do is we measure, for example, if we work with at one time when I used to be the director of Ceasefire Illinois, we worked with 1,200 high-risk individuals, and we pretty much spent 22,000 man hours with those individuals over the course of a year and a half or so. And then we captured when the guys did not reoffend. So we had a 70% success track record with people not reoffending. That's not too bad right there. 70% of the 1,200 people we work with did not reoffend. That's important numbers to put out there.
Thank you, Theo, for sharing that information. One of the things that I would say in changing social norms is identifying the pie. And when I say the pie, I'm talking about the person and their environment. We have to look at the individual and environmental influences that determine the reactions that they may have exhibited. And in that assessment, you're trying to coordinate and work from a space using the strengths-based model. That what are their strengths? We know for African American communities, many are faith-based, right? They rely upon the church as a space of healing and support. So you want to work with them in a space where they feel the strongest, not focusing on the areas where they feel the weakest, but helping them hone into their strengths and recognizing who they are as individuals and how they can work from a space of healing. How can they work from a space even being traumatic, having trauma experiences, working through that to change what the norm for them is. And when we say we're working with that individual in their environment and meeting them where they are, we have to also understand that sometimes they return to the very environments that have caused the destruction, to the very home where there isn't a parent, to school where they don't feel like they don't have the support. So how do we support them in that journey to change social norms that will we feel like that they can function and thrive? So I personally like to work with the person using the pie, the person in their environment, looking at all of the environmental influence, how they intersect, and what can we do to change that trajectory? How can we give them tools to be supportive in those environments that they have to return to?
Very important.
I think there are two other really important pieces here to kind of add on to the really important information that's already been shared, but policy is one. You know, we've seen policy change social norms over and over again. I know gun control is a hot button issue, but there are some places where we can meet. And, you know, a couple of examples of that are that, you know, people that are perpetrators of domestic violence should have a harder time accessing guns. You know, so there are some places to really meet and think about how policy can shift those norms. And I'll say that knowing that we live in a very politically angsty, polarized time that it's pretty sad to witness and see. And I'm sure a lot of people here have many thoughts about that. But what I will say is that, you know, guns are not going anywhere in the near future. They're not. I wish they were. And so gun safety has to be addressed and talked about, you know, and when we talk about gun violence, yes, there are assault related issues, there are domestic violence related issues, there are community violence related issues, but suicide and unintentional injuries as a result of guns make up a substantial number of injuries and deaths that we see each year. And there's been quite a bit of success in changing norms around gun safety, you know, providing lock boxes, biometric lock boxes, other safety measures, doing educational campaigns and training around gun safety that have shown some really big success in significantly reducing rates of unintentional injuries. And we've seen some high profile unintentional injury cases here in New Orleans with really young kids. So that's a very good example of how we keep guns away from small children. And then also, in, you know, giving people a little bit of space to reach out for help before they reach for a gun to hurt themselves. So it's a really important piece of this too. And I want to, you know, some of the arguments I hear about this are, well, you know, I have a gun to protect myself and then I don't have easy access, when in fact, knowing how to safely handle a gun and how to store it properly and unstore it properly, that in some ways gives you just as easy access and prevents other people around you from getting hurt or from you hurting yourself. So it's a really big piece of this. And I think if we can normalize gun safety, we might make some headway here, particularly amongst folks that are really adamant about having weapons.
Yeah, for sure.
I'll piggyback a little bit on what Dr. Fleckman said, but the idea of violence as a disease is a relatively new concept. And until fairly recently, there was a ban on government funding for studying specifically gun violence. So if you look at all major killers in our country, they've been systematically researched and studied. Different, treatments have been studied and trials, and we don't really have that in the violence prevention world. And so we really need to study how certain policies affect gun violence and how certain interventions affect gun violence. So there's a lot of work that needs to be done from the research aspect of it.
Yeah, for sure. We've lost, 2 decades of research on it or more.
Yeah, I'll also mention there's a comment that just came through about how we treat this like other public health matters. And I think about this piece related to seatbelts. 60 years ago, even 50 years ago, in the past generations, nobody wore seatbelts. You talk to folks and that was not a normalized thing, and policy is what changed that. Policy shifted that. I think you could say the same thing about car seats as a safety mechanism, right? And these are different issues, obviously, but I do think there's some to learn about how we promote those types of safety tools as a way to mitigate some of the impact.
Definitely. Related question in the chat to all of you: if we enact stricter gun control laws, won't other forms of violence just fill the void? And, what do we do about that?
The stricter gun policies, like in the state of Illinois, we have some of the strictest gun laws in the United States. But we have to work harder to change the mindsets. We have to change conditions in some of these impoverished communities and make sure everybody has an equal access to some type of opportunities, a pathway to success in their lives. You look at some communities like in Baltimore, even in New Orleans, some places like in Memphis, St. Louis, Missouri, up and make something out of their lives. Some people take care of their business, but a lot of people, they fall through the cracks and crevices of society. So we have to work harder to change actual conditions in some of the communities so that people have an opportunity, so they can see an opportunity. It's a difference between being able to at least see an opportunity. Now, I grew up in the projects, and I could look at downtown Chicago from the window of the projects, and I knew there was another world out there as a young man. So I was able to go downtown and meet different people, and that was like my outlet from that type of environment. Even though I didn't live downtown, but I knew there was a downtown. Young people and young men and women, they need to be able to see something that's tangible, that they can hold on to, that gives them some hope, because there's a lot of despair in some of these communities out here, and the prison industrial complex is kicking in. And believe it or not, a lot of the gun violence, especially in Chicago, it's a lot of interpersonal conflict, because a lot of times you have an anger scale from 1 to 10, people are on 10 already. So all they need to do, if you bump into them, they're ready to shoot you. If you look at them crazy, because they're already on 10. We have to bring that anger scale down to like 1 or 2 so we can really make progress as far as in the arena that I work in. Somebody asked about collaboration. Who needs to be at the table? Faith-based leaders, law enforcement, social service providers, like I said earlier, and then doctors, lawyers. Everybody. We need all hands on deck. Everybody needs to be at the table so that we can just meet the needs of the people out there. On every level of society is very, very important.
Yeah, and I agree with Tia. If you look at what the pandemic has done to gun violence and the incidence of gun violence, it's skyrocketed. And Tia talked about that anger score. We're seeing like interstate shootings where people are on the interstate and just randomly shoot some other person they don't know. And so it used to be that you cut somebody off, they flipped the bird and moved along, but now they're shooting at you. So,
right.
I think our culture has changed, and we have to do something to kind of get behind or get in front of that.
Yeah, I think the pandemic just uncovered really major existing structural inequities that already existed, so it exacerbated or maybe further propelled some of this, what was already there.
Yeah, definitely. It sounds like, all of you have talked about how we address root causes and really focusing on these structural and social determinants. As we kind of get close to the end and wrap up, and I know these are related to how you would probably address inequities related to violence, but any other thoughts on where we focus our efforts in moving that needle up to these structural determinants and social determinants, and how do we best do that in your work and where you sit? Sharvin, I'll start with you. I know you're on the front line, and so like from a hospital perspective, you guys are seeing it there.
Yeah, so I mean, again, I think it goes back to research and identifying particularly what those social determinants and what those structural factors are that lead people to pull trigger of a gun or lead people to other types of violence. So I think research plays a big role. And then again, collaboration, getting with people who have different types of skills that can address all the needs that victims of gun violence have, or victims of violence period have. I think, it's going to take, there's not one answer. It's a multifaceted, it's a very complex societal problem that's going to take several different aspects to treat and make better.
Yeah,
go ahead.
I'm sorry.
No, go ahead. You good?
I agree that definitely collaboration is priority. It's not one space that we can definitely navigate for a resolve. I think it needs to be everyone on board, including the system. And when I say the system, the DA's office, law enforcement, all of those other agencies. In order for us to work for a better community, we have to all be in agreement to work together. Working in silos doesn't resolve the problem, right? And always assuming that your way is the best way doesn't resolve the problem. So we have to be willing and be open to work together to help those individuals that need us most. But most importantly, taking care of yourselves too in the space of healing others. You have to take care of yourself. Because you're no good to nobody if you are burned out. So working together helps alleviate burnout. So it's not just you in the space attempting to change a social norm. But one of the things that I would like to add is identifying risk factors. We have to understand what the risks are to work to support that individual. So that's just my thoughts.
And the only thing I was going to add is that everybody should have a unified message from the president all the way down to the young brother on the streets here. Just imagine a big public service announcement with all kinds of key people speaking on behalf of violence being treated as a public health, issue. And just educating people. That would be major. Some athletes, president, like I said, young guys, young women from all walks of life, just saying, look, if we all unified and having congressional hearings, Senate hearings on a U.S. Capitol level and the state level and the automatic level in the cities and on the ground level, town hall meetings where everybody's just pushing the same message to change the norms. We have to get out of this here fog that we're in and change the norm, because it's crazy in Chicago. Every year, the first of the year, we already predict there's going to be over 400, 500 homicides in Chicago before the end of the year. And that's the same in a lot of different cities across America. That's totally unacceptable. We have to change that norm, sincerely.
Yep. I couldn't agree more with my fellow panelists and many of the folks in the comments here. And I would just say, it's really thinking about economic policies that support families, that reduce racial, structural racism and reduce racial inequities. We need to think about economic supports directly to families, housing. I mean, people need these are basic human rights. And we need to provide for them. So I think that's a policy angle. There's been quite a bit of evidence around, cash transfer programs that have improved a variety of outcomes. In fact, one of our colleagues is working on one here in New Orleans right now. And So I think it's that all the way down to these, thinking about social norms and then more supportive interventions for communities and families. Trauma-informed schools and school systems are a really big piece of this, how we build those out for young folks and really think about things like conflict resolution, violence interruption, as Tio has mentioned, is a really big piece of that, those key messengers and who they are. All the way down to the support and services we provide people that have experienced violence and trauma, more broadly speaking, because they're more likely to experience it again. And be majorly affected by it, and their support networks as well. So I think it's all of those things in combination. And then what Mrs. Jackson Snowden said as well is like really doing that in collaboration. We're not going to do it alone. No one of us has even a quarter of the answers. So we've got to figure it out together.
And then whatever that intervention is, we have to make sure that it works, because if it's not working, then it's a waste of time and money, and we need to go back and try something else.
Yep. Adapt. That's a very important piece of it too.
Yeah, dissemination, scale up. We know we do have some tools in our pocket of things that do work. And related, someone mentioned in the chat that there's some fantastic TV ads done at the beginning of the COVID pandemic. Why can't we develop some spots using prominent names, offer some attitude change regarding our interdependence and alternative ways to deal with anger? We do see so many types of gun violence, and there is this one that is politically motivated, socially motivated, given the divides we're seeing so much in our country right now. Maybe media maybe can fuel this fight as well, but it won't solve the social determinants that are not only impactful for violence outcomes, but many health outcomes as well. Anything else, guys, before we wrap up and, kind of thoughts? I know there are a few more questions. I don't know if we can get to them all in time, but I will, I'll offer one. Let's see. And, I think this might be more challenging too, but how can we provide anger management and conflict resolution on a community scale to get ahead of the problem? Who or where can we do this? Is one question. I'll open that up.
Yeah, we're doing that already on behalf of Violence Interrupters. I organize restorative justice peace circles right in the heart of the community, and we deal with anger management topics and conflict resolution. And I train young guys and young women in the field of conflict resolution. They're not even working with my program. I just do a community training. So more training across the nation would be great for right now. And people can also visit my website at violenceinterrupters.org. Violenceinterrupters.org. There's a lot of information there in regards to, as far as the work we do.
Yeah, for sure. And scaling it up, right?
Yes.
Violence interrupters should be a basic part of maybe, municipal offices throughout the country and other programs too.
Other programs as well, because I believe in collaboration, and I never sit up and try to take credit for everything. I believe we all just work together. That's what it's all about. There's nobody on the island working on independent silos or whatever. We all play a role, all of us.
Any other thoughts from the great panelists here today?
Just appreciate being in the space with you all. Really great conversation.
Yeah, it's been great. Well, thank you for sharing your thoughts, your wisdom on the topics.
Just to be here. Yeah.
Yeah, and for all the work you guys are doing from every angle. Well, and we hope you found the conversation timely and illuminating, and that you join us for upcoming activities with P4HE. Please mark your calendars for Monday, September 26th at 1 p.m. Central Time for our next webinar on housing and health equity. And then we also want to take this opportunity to announce our first membership virtual meet and greet that will take place on Tuesday, October 14th at 1 p.m. This is for individuals who are formally joined into the collaborative. So if you're interested, please take time to sign up and get more details. And of course, staying connected is a great way to be part of the conversation. So please visit our website for more information on P4HE and upcoming events, how to be a member, and follow us on social media. Thanks again for joining us, and we look forward to hosting you on September 26th. Thanks, everyone.
Peace to everybody.